ladies and gentlemen. I'm sure we can do much better, so let's please put our hands together one more time. Thank you very much.
Yes, I believe speakers are already getting mic'd up. Probably everyone has mic'd up because we had quite a bit of time. We want to go into our breakout sessions, and we only have 45 minutes, I believe, right?
That's right.
And we'll be very strict with time today because we do have the Deputy Governor of Lagos State coming to address us, and then finishing the day off with the Ideathon Collaborate Lagos. So for everyone who is interested in my favorite, can you guess what my favorite is?
I know, it's education.
Yes, education. So everyone who is interested in the education breakout sessions should remain in this hall, and everyone else, they are clearly labeled, and we have, I think yours is healthcare.
Yes, I love healthcare, by the way, but I would prefer tech. That was yesterday, okay? But I'll also go for transportation, okay? Because I see myself owning Joe Hansen, Keke Napep, digital AI.
Yeah.
That's the future there.
That is the future. And we also have agriculture and energy and environment. So I believe there's something for everyone. Healthcare, education, energy and environment, transportation and traffic management, and agriculture. So please, everyone who is here, I believe, wants to be part of the education.
So let's reiterate.
Breakout.
The breakout sessions are 5 in number. We have 5. Here in this hall, the main hall, is for education. So if you want to attend the breakout session for education, please remain inside this hall. Remain in this hall. But if you want to attend the others, such as healthcare, energy and environment, transportation, traffic management, which is very key, agriculture as well, please, you would find the breakout session or the rooms just outside of this hall, to your right and also to your left.
And to all our virtual viewers who have stayed with us, please do not go anywhere, because all breakout sessions will also be streaming online at aotlagos.com/live. So please stay back and join the breakout session. I think the virtual viewers have a bit of an advantage because you could slip in and slip out of different breakout sessions without really getting noticed.
That's right.
So if you're for education, please just remain in the hall, the other ones. Please remember that we have exactly 40 minutes. It's about 1:51 now, so if I do the math, we have till 2:32.
Okay. And we're also going to announce that you would be given a headset, all right? Please, when you have them, ensure that after use, you do return them. I think yesterday, I must say, we all tried by returning them. So let's also do the same today, all right? Quick announcement again, distinguished guests. If you want to attend the breakout session for education, it is holding here in the main hall. For the others, such as healthcare, energy and environment, transportation, traffic management, and agriculture, you'll find them outside of this hall. There are segmented halls outside of this hall, and they are rightly labeled. So check the labels, and then you can attend which one you prefer. But please do not forget, distinguished ladies and gentlemen, that we have just 45 minutes. So we're pleading to all the panelists to take note that we have just 45 minutes for each and every breakout session.
Yes, and for those of you who are just waiting here for the education panel to start, please use this opportunity to engage with us across our social media platforms. Let's see your videos, your tweets, your pictures, hashtag AOT Lagos, hashtag Art of Technology Lagos, and hashtag Smarter Lagos.
Thank you very much, distinguished ladies and gentlemen. We will be back to inform each and every one of us on our timing. So right now, let's also use the opportunity to announce the panelists that will be handling education here with us. So for those who are here with us, we believe that you are keen and ready to attend the panel session on education. And who do we have?
We have Eyitayo Ogumola, founder of UTIVA. We have Mrs. Folashade Adefisayo, the Honourable Commissioner for Education, Lagos State.
We also have Otto Orondam, founder Slum to School Africa. And not forgetting too, we have Adeye Oluwaseun Shobo, a founder of the International Teachers Network. And lastly,
Godson Ogunka will be the moderator, and he is the co-founder and CEO of Pan-African Spark.
That's right.
I believe the headsets will soon start getting passed around. I see people already holding them, getting them fitted. Please remember to return them once the session is over. And I believe our job here is done.
That's right.
The Deputy Governor arrives.
That's right. So please do well to enjoy the breakout sessions, distinguished guests.
Is there any...
Please can we have the microphones of the hosts switched off? Thank you.
So all our education panelists, please will appreciate if you can come to the stage. I think we can give them a warm round of applause as they come to the stage. We've introduced every one of them.
Done? So what do I do with this?
This one. Yeah. There's no speakers, so this is what you listen.
Okay. So Tremendoc is a telemedicine platform.
I'm sorry?
Tremendoc is a telemedicine platform.
Oh, really?
Yeah. And we're doing something, we're piloting something with the Health Service Commission for digitalizing the hospitals, the general hospitals. Yeah, so we've onboarded one already, so we're just piloting to just get it perfect and running. Yeah, there we go.
Huh? I wonder what's there. Your slide to get what?
Your slides. We're trying to get your slides.
Mine?
Slides.
I don't have slides.
Yes, I do. I think that's what she's saying.
Are we supposed to be using slides?
No, that's me. That's me.
Oh. Let me just.
Judith. No. Keep it for me. Hold. Okay. Hello? Hello? Yeah. Hello? Okay. All right.
Can you hear someone talking?
Yes, I can.
Who is talking?
I have no idea. One of the production, probably the production crew, one of them, I don't know.
Yeah, talk.
Or probably another panel, on another panel. Oh, the same Ministry of Health you can hear talking. I don't know. I don't know if they're speaking to us.
Who is talking, by the way? Yes. Why is a Greek talking to health? Did we ask you for packages? Did we ask you? I didn't ask you for packages. Yes.
I can't put so this stress.
Okay. We need you to keep our babies and our children healthy. So give us a balanced diet, please. Where are you anyway in this mysterious cyberspace that we're in?
Okay.
So today we have, so I'm just going to...
Okay, better stay there.
So on my right,
Okay.
we have Honourable Commissioner for Energy and Mineral Resources for Lagos State. Thank you. And on the far end there we have Mr. Ayodeji, who is CEO for A4NT. Welcome.
Thank you so much. Good afternoon, everybody.
Online we have
Driver.
What I really wanted people to sort of take away, especially as before we go into the discussion.
Yeah,
Yeah, maybe I'll just scream. I'll just try and be loud, if that's fine with you.
yeah.
So here, as we've been hearing conversations about around big data and how we can make data work for us, right? I want us to sort of think, as we're having the discussion, three key areas. So I want to make sure that as we're thinking around this, we want to create an enabling environment so that stakeholders are actually able to come together and work together to actually come up with the solutions that we need for Lagos to go to the next step. Secondly, well, as you can see, we have people both from the private and public sector.
Hello? 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 Some people can hear me. I think some people can hear me. Without mind. Yeah, but I think some people can hear me because I'm saying hello and they responded to me here saying hello too. Yeah.
Everybody has input of their own about how they experience time. I'm really hoping that our panel's expertise here will help us get one. These are just your mind about the energy gap that we have in the community. These are
Hello?
conversations around how we need to get better and more accurate data. So the numbers
Okay. Okay, that's why we've been hearing other people. Okay. Hello? Oh, wow. Wow.
done around data gathering, trying to get addresses of people, trying to get people more ready to be online in terms of payments as well? Where is the work that you're doing now?
Please start, sir.
Where are the gaps that you see?
Yes, I am.
Start this session.
Okay, so basically, no one has told me about how it's going to go. Yeah, no one has
So,
told me.
the floor is yours. The moderator.
Thank you. Can everybody hear me? Because we're in out of technology, I'm going to say the same thing that everybody's been hearing all day. For us to be able to do anything about planning, we need to know what the information out there is. We need the data. We have different sources of data gathering in Lagos State government.
What is more?
We have Lagos Waste Management Agency that supplies or that collects the waste from all around Lagos. We have the Lagos Water Corporation that supplies water to Lagosians, and they also collect data on the water supplies, not as accurately as we'd like them to, but they do collect it. We have a partnership with the distribution companies to help us understand how much energy is being consumed by Lagosians, and we intend to make that, we intend to improve that data collection and to improve the collaboration that we have with them. For us to be able to determine how to help Lagosians also have to come forward with information. We have, as was described yesterday, an agency called LASRA, Lagos State Residence Registration Agency, that's taking on the data of all Lagosians to try and understand where they are and how many people there are in Lagos. When you hear information about Nigeria that makes you worry, it's compounded in Lagos. So there are 200 million Nigerians, 12% of whom are in Lagos. If 12% of Nigerians are in Lagos, then you expect 12% of the landmass to be in Lagos. But no, Lagos sits on 0.4% of the landmass in Nigeria. So that tells you that Lagos is a crowded city, and it's getting more and more crowded by the day. So for us, we have to start to think about energy. We have to start thinking about the environment, the environmental effects of the energy we have today. We talked about diesel generators and us spending 14 billion on diesel generators in Nigeria annually. I think that a third of that spend actually comes from Lagos. Then we start to understand the scale of the problems. So we are in the process of improving our data gathering efforts so we can start to target the areas of Lagos that we need to address. I'll give an example. When COVID started, and we'll talk about health a bit, when COVID started, we suddenly realized a need to start to get energy out to the most vulnerable communities. And we sat down with the Renewable Energy Association, and 5 of them working with
Testing.
Okay.
take some data and then try and determine the most vulnerable areas that we deploy the solar home system solutions. We also had to determine where the warehouses of the suppliers were such that, again,
So where do we stand?
find out where the
Do I
closest
sit
warehouse
down
was
to
to enable them also to deploy them in the most vulnerable areas, such that they're not crossing too many communities to get there. So we had to leverage the available
Yes, I can.
data to enable us to do that. And when you look at the hospitals as well in Lagos, we identified 19 general hospitals in Lagos and determined that we had to improve the electricity supplies to them. Some of them are getting 2 hours of electricity per day,
Good afternoon, everybody.
which is really bad.
Pleased to be here. Good afternoon, Honourable Commissioner.
We try to determine how best to fix
So today, I'm going to be moderating the session,
Lagos State electricity.
with the Honourable Commissioner and then other panelists. Some of them are probably online. I'm not sure if they are here yet. But before we go into that, I have a very brief presentation to give around driving a data-driven model of healthcare delivery. First of all, I would like to introduce myself. My name is Chikezie. I am the founder of a company called Tremendoc. Tremendoc is a telemedicine platform. So what we do is we're able to connect patients, users to doctors. And these doctors have been aggregated across Nigeria, and they're able to consult with patients real time using their smartphone or mobile app. They can chat, have audio and video call with doctors real time. I'm also the co-founder of a company called Box. It's a lifestyle solution company where we've been able to aggregate cinemas and then we're able to make these cinema tickets available digitally to users, or concert tickets as well. So we sell most of the major concert tickets in Nigeria between Lagos and Abuja, and also food delivery as well. So let's go to the core. The overview today is post-pandemic healthcare market. We're still going through the pandemic currently, and what it would look like post the pandemic, and the technological trends and big data, what this has brought, what the technology trends are. You can move. This and how this data can be used to improve healthcare in Lagos State. So post-pandemic healthcare market outlook. What I tried to show here is how the pandemic has exposed the weak healthcare system we have in Nigeria. I think we've already known this before, but basically what it has done is shown us how the system was hit hard during this pandemic. Number one is the population that is growing much faster than the growth of the services. Right? The inadequate financial allocation to healthcare. In Nigeria's budget totally, healthcare just covers just about 4% of the entire budget we have in Nigeria. In other developed countries, healthcare takes a huge chunk of this. The inequity in the distribution of healthcare facilities and manpower. Most of the primary healthcare centers,
thank you so much.
Some of them are not operational fully, while some, which are operational, don't really have, manpower resources, which would include doctors most especially. And most of them just have healthcare workers in there. So some of the lessons and what this has brought about, there's a surge in the use of technology. We've seen technology like Zoom, virtual meetings, virtual consultations, which includes telemedicine. There's been a high rise in the use of technology, and then that brings about a lot of data. So what technology has been able to do is give us access to a lot of data real time. And now what we're going to see here is what that data can do for us in the healthcare system and how to harness the data. So going further into the use of technology, there's artificial intelligence, machine learning. Even during the pandemic, we've not been able to harness this part of technology in Nigeria. But we're hoping, and there are companies coming up with different interesting ideas. Telemedicine, companies like Tremendoc were able to, during the pandemic, we were doing as much as 1,500 consultations in a day because of the lockdown mostly. Wearable devices. This is a very good technology that has been introduced, has been around for a while, but now it helps us clean out our data. For Tremendoc, for instance, we have wearable devices that we're bringing out. That what this will do would allow the doctors on the platform be able to get real-time vitals from the patients, whether it is their temperature, whether it's the blood pressure, real time. So they're able to tell. Because this is remote consultation, this particular kind of technology is very important. And like we said, it's the use of technology during post-pandemic and moving forward. So what are data sources? If we're talking about data, when it comes to healthcare, what are the sources to get this data? Number one, I just mentioned the wearable devices, and then the electronic health records, which includes clinical records when you go into the hospital, when you consult with a doctor online, whether it's through an app or it's maybe via a phone call. Lab systems, from going to run tests in a lab, that data is collated, is used in hospitals, and is part of your medical records at the time. Telemedicine, I've mentioned already, consulting a doctor through an app or a phone call. There's a huge source of data from this kind of practices. Pharmacies, when you go and buy drugs in any particular pharmacy, that's some data there, whether it's a pregnant woman who needs this kind of drug, or it's somebody who has malaria or has typhoid and has been given a prescription by a doctor and walks into a pharmacy to get a drug. Insurance providers, these insurance companies already have aggregated a lot of hospitals across Nigeria, and they also get real-time information from these hospitals for them to give claims out to the hospitals. So they are a huge part of collection of data. And one of the things that data will allow us to do is run analysis with this data, which gives us more informed decisions, make more informed decisions in the healthcare sector. And so these are kind of the analysis that we can use with the data. There's clinical analysis using the diagnosis, prescriptions that are given to you by doctors when you walk into the hospital or a doctor sees you, via telemedicine. There's patient's experience. So we can tell real time using this data how the patient was treated. If the patient gives real time feedback, and we can use this data to understand how to treat our patients better, whether the doctors are working, are treating them better, nice to them, are showing care. Like on Tremendoc, for instance, after consulting with the doctor, you are able to give stars to the doctor or favorite the doctor. So those kind of things allow us to understand how we can, make our doctors work better with the patients. And then there's population health analysis. This is the most interesting part, where we can predict, using data to predict maybe possible outbreaks in different regions, for instance. And then I think I'll come back to that at some point. Operational efficiencies. So now this is what we want to, no, you can go. This is what we would like to talk about, a data-driven future for Lagos State. How do we use data to make Lagos State and its healthcare system better? So one of the suggestions I'm bringing is adoption of a statewide telemedicine network. What I like to say to people is telemedicine is data without borders. You get real-time data without borders. So for instance, what it will take one hospital to bring out when it comes to data, a telemedicine platform who, like Tremendoc, for instance, we've done over 75,000 consultations in just the past 6 months. And these consultations are done by people who are in Oshodi, people who are in VI, people who are in Lekki. But basically, it is very easy to get that data immediately. And because when you sign up on the platform, you're able to put your gender, your age, and we're able to give this information, which the hospitals are lacking, and not because of anything, just because of the way it's structured. It's a physical building. If I have one hospital in Oshodi, I get data for just Oshodi, and it might not just be the entire Oshodi, but just my little community. That's the kind of data I get. But telemedicine is able to give you data across the whole of Lagos. Adoption of a uniformed statewide EHR system. So EHR, like I said, is electronic health records, where imagine a situation where the EHR systems are able to collaborate with telemedicine platforms. They're able to sync their data together, and then they're also working with health providers, which are hospitals. They have these systems in there, and we're able to sync our data together. Then data analytics, which is what I was talking about earlier, where we use this data, analyze this data, and are able to even make precise and predictive consultations. So going deeper in there, one of the suggestions I'm making is, if we can develop, Lagos State can develop a regulatory and a legal framework for all telemedicine platforms, so that we are able to take out the shafts from the real deal. We're able to get telemedicine platforms who understand data protection of users, are able to secure the data that they receive, and not make it available to anybody, because personal data of the users are very, very important. Provider payment. So payment is also an issue when it comes to telemedicine. A lot of people in Nigeria do not have bank cards. Some of them are not even bankable at all. So basically, payment is a big issue. Most times, insurance is really the best way, where we can create a structure where payments are made easy and people have access. So pathway for feedback, which is what I mentioned. Through telemedicine, it is very, very easy to get feedback instantly from the user. And the user is able to talk about the treatment and how the doctor worked with him or her in making sure that she or he gets the right care. What's going on? So deployment of a uniformed EHR solution. So coming from telemedicine and then the integration into an EHR system, I believe that this data, I'm looking forward to a world where we have a unified data system where from telemedicine platforms having to integrate with EHR systems, and then they have this unified data. What this would do is, as a patient, after consulting with a doctor virtually, you go walk into a hospital, and then the hospital would have access to the consultation that you've had instead of going through the same process again. So you're able to access your data, whether it's remote, and vice versa, meaning a telemedicine platform could also have access to the data. When the patient wants to consult with the doctor is able to consult and see what you had done, when you went to the hospital physically. This data integration would be great for us to understand how when we have unified data. So whether it is somebody who consulted virtually or somebody who walked into the hospital, the different platforms or the doctors on whether it's a virtual doctor or it's a physical doctor can have access to this data instantly.
Absolutely. Thank you so much for that, sir. Yeah, Honourable Commissioner, please.
Can you move, please?
So just to say that one of the reasons why public transport is expensive in Lagos is because the various modes of transport are not integrated. So
so for data analytics, so when we have this data, unified data, what then can this do for us? Number one is descriptive analysis. So meaning you walk into the data collected from doctors when you walk into the hospital, and then they are able to make your diagnosis. First of all, that data is your diagnosis data. So first of all, the doctor is able to know, or the health system or the health ministry is able to know at this point in time, at this place, somebody had or was diagnosed with malaria. She is female, or there are 50 people in Oshodi diagnosed with malaria at this time. Then diagnosis analysis, why did it happen? What is causing that illness in that area? These are the kind of things that we're able to deduce from this. And then we can predict. Predicting means, imagine a situation where we can tell that there can be a possible outbreak of cholera because we've been able to see real time people having symptoms of this particular disease, at this particular place, and it's mostly happening to females. And then lastly, what we can do is descriptive analysis. How do we solve it? If we are able to see real time with the data that we've gotten that there's a possible outbreak happening in Agege, meaning that we are able to think about a situation or a means to curb it instantly before it spreads.
Everybody here knows GIG, right? Particularly, the transformation that the company has embarked on over the last couple of years.
So another thing is on data security. I think this is also very important, even as we are talking about how great
we don't quite understand what's going on there. But you're here today, so I'm sure we'll get some insight.
Know that security is very important. So what I'm proposing for Lagos State is to create a system where data and devices, encryption of data and the devices used to make sure that we're protecting citizens' data, and then create a situation where there is firewall security software, and a situation where the servers can be wiped out when there's a possible intrusion in the data. So basically what we're saying is, it's not just all well and good for different platforms to wake up and say they are telemedicine platforms. There should be standard rules that they have to meet as companies for them to handle people's data and for them to provide the services that they are providing. I think with that, I'm done for today. Thank you. So we'll be moving into the panel session. I know that there will be questions that you'd like to ask, but first of all, I have a few questions to ask. I don't know if our other panelists are online virtually with us, or it's just myself and the Honourable Commissioner here.
Into ensuring that we create jobs, the money we've put into ensuring that we meet these challenges that were there. So the major challenges I would say we face is really non-inclusion. When government is making policies, government, I don't know, they'll say they meet with stakeholders, but I want to say GIG is one of the major stakeholders. And so some of these things are done and you don't even hear about it. The next thing you see it in paper. And so your plans, your projections for the next 5 years, you find out that you have to go back and start projecting again because there's no inclusion. So I'll say the major challenge is that now the private sector is going to work together. But let's have that round to the top. Before you do that, and that's going to affect everybody. Let's have everybody together in the round table. We're going to do this policy that is going to affect you. So if we can have more of inclusion into government making policies that affect transportation.
Wonderful. Building on your question, and I would build on your question and ask our Honourable Commissioner for some insights here. So the point you just made about government policy, changing. The specific example you've given is at the federal level. Now, the Lagos government has a transportation master plan, but it is the Lagos Transport Master Plan. We haven't heard of a Nigeria Transport Master Plan. So what kind of what's going on there? For this whole thing to work, the states and the federal need to be aligned. There are certain things that all the states need, but some of those things are controlled at the federal level, especially things like import duties and things that fundamentally affect the economics.
I believe that
of investing into this
some
industry.
of the panelists online.
What is going in there? Between the states, Lagos and the federal,
by
to create a harmonized system that investors can feel more comfortable about.
What you do.
I'm going to have to jump into it anyway. You see, Lagos State has gone too far. Normally, in an ideal situation, what happens is that the federal government develop its policy, and then the state government now tap into that policy and then develop a policy that is consistent with the federal government policy.
Yes.
We have been waiting for the transport policy for over 20 years.
Oh my God.
It's still in draft form.
Okay.
So Lagos State could not wait.
Yeah.
And so what we simply did was to go ahead and develop our strategic transport.
Okay. Hello, can you guys hear me?
Yeah. So if we wait for the federal government, and in fact, you can imagine how chaotic it was.
Absolutely.
So I can understand his pain. And one thing I'm going to say here, and it's important that we lay down. The transport sector has suffered from the fact that everybody feels that they're a transporter. The transport sector is the professional sector. And you have to be trained to operate in the transport sector. I mean, you look at what happens feel that they own the transport sector. But when you go to the United Kingdom, when you go to America, you go to university to study transport planning, you master in traffic engineering, etc., and then you move into the transport sector and you do it. So the transport sector cannot be left to, let me use administrators or admirals.
Okay.
Because it is the engine of any economy.
Absolutely.
It's just like buying a new car. You can't buy a new car and then go and give it to a roadside mechanic. You've got to give it to a dealer that is qualified. And that's what we suffer. So you have people who are not supposed to be making transport policy, And that's why, but Lagos State is changing and hopefully it will get to the
center.
So when you go to, you look at agencies like I mean, Tremendoc, there's qualified transport operators. You go to Lamanta, it's full of transport, I mean, qualified transport engineers, etc. that are trying to build the rail.
Okay, since we can't hear our panelists online, so I'll go to the Commissioner, Professor Akin Abayomi. Great to have you here, sir.
Let's leave the profession.
I would like to
transport plans, and then we'll get a better outcome.
What is Lagos doing when it comes to, you know,
so that's simply the answer to
integrating EMR across?
Absolutely. Thank you so much, sir. I have a question that I would like all our distinguished panelists to take a stab at. The mobility, and I'm building on the last answer you just provided, Honourable Commissioner. The mobility and logistics industry is very technical, very complex, and very challenging.
You know, spreading,
this means that you require the smartest and the toughest people you can find.
System
how are you building capacity? How are you finding talent? How are you? So if the admirals need to take a bow and that void needs to be filled by a new class of people that are highly trained, highly skilled, as you rightly mentioned, sir. How are you bridging that gap in your current capacity?
Mechanism that is overarchingly responsible for protecting data of Lagosians. There is a national data, private data protection guidelines. Anybody manipulating patient data must be compliant. And that's not an easy thing. It's a very elaborate process.
The informal
state as
the informal sector are dominating right now. Okay? So once we started this over 5 years and we're beginning to get good graduates moving into the logistics business. Now let me give you an insight into what is happening in Apapa and then over the next couple of years we'll see a massive change.
So that's on the
Apapa, the problem with Apapa is inefficiency. So you have various people in a port who manage the operation.
Anybody to have
so
access
when a
to
ship comes,
data
you know the number of containers,
regulatory
and then you count the number of spaces that you have in your port, and then based on that, you now call up the number of trailers that will fill those containers. Okay, that's the, I'm just simplifying it here. That's the way it's supposed to go. But what happened is, all the truckers are hovering around Apapa. So people, they get a way of when a ship is coming, and then everybody troops into Apapa, there's no control. So what do you need to do in Apapa? And this is where the smart and tough people will come in. So first of all, you need to develop truck parks in Apapa. So there's one in Apapa, the Lily Pond,
and of course storage.
To develop a truck park in Ogun State.
Servers,
so what happened is that everybody, because
once we've built that ship, as we described
if you don't have any business in
then we can superimpose.
You don't get called up. So this is where technology plays a key
of any kind.
So you now use the call-up
medical records,
to link the various
administrative records, whether it's
so you know the number of vehicles that are available, you know the drivers, you know the
apps will now sit on the network. But the most important thing is to discourage haphazard deployment of electronic medical records, because at the end of the day, you may have problems synchronizing and harmonizing to build interfaces between a variety of apps. And secondly, it might become confusing in terms of ontology, because one app is using a variety of ontologies
so that you can monitor
physical
and ensure that
diseases,
only
another app is
trucks
using
that have
different
business
ontologies.
that day
Oh
my God. Smart technology comes. So you need
the foundation is regulation.
The smart people to ensure that they're able to program all these different software and then manage the affairs of Apapa. But when you leave it to
one of the priorities
the informal sector, no technology, the result is what you find on the platform. So you need smart people, you need technology, and then you need a robust
other technology to jump.
Absolutely. Mr. Fala, do you have any programs within Primero? What are you working on this talent problem?
Network across the state. Once you have that network in place,
and they send all their interns to us. And we've also promised them that everybody with the first class gets an automatic job. We're also working with Futa in Akure and Ladoke.
During the pandemic, I know that there was a lot of data that was received from health issues and all that. What is Lagos State doing with today, and what have we learned from the new?
I think LASU is probably the first one. And LASU, I don't think it's even up to 10 years old or so. School of Transportation, I don't think it's entirely on data intelligence. They're all relatively young. So what we are trying to do is to encourage the universities to get into School of Transport. And look, when you go to School of Transport, you can learn about warehouse management, you can learn about traffic management.
Can you hear us properly?
There's so
no,
many
you can't.
aspects of it. It's not just, everybody sees the bus going on back and forth. But what goes on behind
I can hear you a bit, but it's okay.
Especially if you're running
an interruption.
Yes. Two buses, no big deal. But if you're running a big fleet of about 400, what goes on behind is so huge because I tell people that Primero is actually a technology company that happens to run buses. It's not a bus company that uses technology because everything we do now is data driven. The problem we're having right now is the traffic.
Check the commissioners on too.
Because what Lagos State government has done, they've given us an ITS system, intelligence traffic management system, that we use to deploy our buses. We use to monitor our buses. We know exactly where they are.
Can you hear me better now? Okay.
Traffic congestion in Lagos throws that land out of it. But having said that, we cannot stop. We need to keep on going to the next level and keep on using technology. And the universities are actually the key to
So I don't know, did you hear what I said before?
Did you hear what he said before?
If you want to set up a bank today, I can go to
my own is louder.
Oh, you are the head of HR. Come and be my head of HR. I can walk into Sterling Bank. You are the head of compliance. Come and be my accounts. And all of a sudden, even though the bank is new, you have seasoned professionals.
Yes.
Okay. One thing that Lagos State did with Lamata was they went all over the world, and this is one of the products sitting right next to me. They went all over the world and picked transportation.
What's the point of all this
people that read transportation and brought them into Lamata to come up with a master plan for Lagos.
Can you hear him now? Okay, great.
In Nigeria, we need to have.
Let me just recap. Yes, the point I made was very important.
Yes,
the role of government is to ensure regulation and to ensure that the citizens of Lagos State are protected from data piracy, data theft, and such kind of thing. So there are very.
All right, thank you very much for that, sir. And Mr. Joel, very quickly, how are you solving the talent, especially with all the new things you're doing? How are you getting talent? How are you training them?
Promulgated by the government, which every state is supposed to adhere to, and we're supposed to be personal data regulatory compliant. But whenever you start dealing with personal data, the first thing you have to do is operate from a compliant level. So the Ministry of Health is ensuring that it is in a position to regulate access to personal private data. And there's nothing more personal and private than your health data. Similarly, there's nothing more personal and private than your financial data. So, for example, your banking data, your health data. These are all very critical, very personal, private data. So we we are ensuring that we have to regulate access to personal data. Then you asked, what are we doing about electronic medical records? And I said that the first thing we're doing is we've launched what we call the Smart Health Information Platform called SHIP. We launched that 12 months ago, and we've been building the concept around that. We've just advertised for an expression of interest globally for people to come and build a network of connectivity in Lagos State with the appropriate digital platforms that will ensure that every hospital, first of all, starting with the public hospitals, and then any private hospitals that want to get involved, can lock into this network of connectivity. Then, of course, you have to store that data somewhere. You can either store it in servers, which is hardware, or you can put it into the cloud. Again, requires very high levels of security, both physical security, levels of access, and cyber security instrumentations. Then you asked me what did we do with data.
Amazing, thank you so much. We have, sorry, we've almost run out of time, but I'd love to take one question, at least from the audience. I'm going to go with a lady. Do we have a lady in the audience? Please go ahead, ma'am.
Institute the same.
What? Sorry. Okay.
So, for example, if we were going to use the same strategy that England and America were using in Nigeria, we would have missed the road completely, because we used our data very early on in the outbreak to discover that we have a totally different profile. So our data was very valuable in the first month or two to define the type of COVID-19 we have.
All right, fantastic. Thank you so much for that. So did you catch that, sir?
Our strategy and devote resources in a different kind of way, as opposed to what was happening in England, America, and Europe, which saved us probably billions of naira, because we were able to define what we actually need in Lagos as opposed to what people need in Europe. So data was the key driver of the Lagos State response. It helped us to change our policies very quickly. It was a very dynamic process. We were shifting the goalposts almost on a day-to-day basis, refining and defining the Lagos State strategy to ensure that we were using our limited resources in a very effective way. And we did that continuously with real-time data on almost an hour-to-hour basis, which gave us a complete picture of what was happening in Lagos State. That data is warehoused in the state, as are the biological samples, because we are the custodians of the data and the samples of citizens of Lagos State. So we have all that data in safe protection as custodians on behalf of the people, and that's the sovereign right of.
Thank you, Honourable Commissioner. So it looks like we are pursuing an inclusive approach and not, throwing away the baby with the bathwater. That's amazing. So we'd love to right away take your closing remarks.
5 minutes,
and as part of your closing remarks, I'd love to
from the audience.
You to talk about, what is in it for women, right? Women have been heavily underrepresented in our transport and logistics space. We don't see that many women drivers. We don't see that many, a lot of women in the transport space. Maybe because it's been too informal for too long. But anyway, your closing remarks and what do you have for women?
Let me start with what we have for women. I would love Mr.
Get a microphone or something.
Yes. Yeah. We don't have a mic, but they can hear you. Yes.
So what you do is
Honourable Commissioner.
now have
Good afternoon.
drivers have pensions, they have health care, they have everything that goes with the company, and so that when women
automation in the medical space.
you might want to
As far back as when I was in university, project
the
for
scheme
electronic
allows that. And that's the reason why we're interested. I can say to you that LBSL, as well as Mero has female drivers, they continue to ramp them up, because with this formal structure, it attracts more women, because they can now see that the framework now suits their lifestyle.
Absolutely.
So it's important that you perform and then bring the women. So that they get in fact, let me just tell you that the female drivers are the best drivers.
Incredible. That is not surprising.
they're very careful. And in fact, let me just show you. The day that we launched the powering car, so the BLT bus that took us to the station, I mean, it was driven by a female driver. Wow. So an Okada just caught the and then the way she braked, and controlled the whole situation.
Wow.
Even the governor was very impressed.
Amazing.
We're encouraging more females to come into the pool.
Amazing.
And then my last remark, after we enter the airport, let me just say to everybody, please obey traffic rules, drive safely.
Thank you very much.
Everything that's around us, let's just keep safe.
Yes, please, sir.
Thank you, Honourable Commissioner. Yeah, please go ahead. Okay.
So,
okay.
I guess you were referring to digitalization as opposed to automation.
Fantastic. Come on now.
So, we know we're actually moving quite fast with the ship. But in the meantime, if hospitals or health facilities...
Fantastic. Glad to hear that. Glad to hear that. And you, sir?
Any form of digitalization, it's okay as long as they are compliant with the national private data protection regulations. And we're putting all our hospitals through training to make sure that they understand what it means to protect personal data of their patients. Your second question as to whether we are keen into the national strategy. Yes, of course, we would love to key into a national strategy, but a national strategy is trying to coordinate 36 states. If we wait for that to happen, it may take longer than what we want to do. So what we're going to do is go ahead with our plan, but keep in mind what the federal government...
Thank you so much for those closing remarks. I've heard someone say that if you want to build a product for everybody, build it for a woman. Once you do that, it covers for everybody. Thank you, distinguished panelists, once again for giving us, the unique privilege of hearing you today. And once again, this is ALT Lagos 2.0. Enjoy the rest of the conference, and hopefully this has been very useful and very informative for every one of us. All right, thank you very much. Enjoy the rest of the day.
Thank you.
Thank you so much, sir.
Okay.
Thank you, Honourable Control.
Thank you very much.
Thank you so much.
We can't get them.
Chief Executive.
So that's
thank you so much. Do you have a card there?
No.
Okay, well, this is mine anyway. Yeah. Good stuff. Good to see you. Okay.
I don't know how I can table these questions. Can help me to relate it.
So, Chief, please come. So, he has some questions. Right, so put those questions together, provide it to him or someone on the ALT team. They'll forward these questions to me. They'll forward these questions to me and then I'll forward it to you. Is that okay?
How do I about cloud? We can actually have them. So what about the young juniors out there that they have these negative vibes, that how can, what are the plans, the structure that the government have put in place and how to maintain it? I really want to know about it, sir.
So, what did you say about negative vibes?
No, I didn't understand that. What about the young people? You said the young people that have negative vibes.
Yes, what I'm trying to say, we have the young stars, first star out there that have...
okay, that would want to hack into
our
data.
Yes.
Okay.
Okay, so that's one of the reasons why we're ensuring that anybody who is collecting data is personal data regulatory compliant. I mean, there are many levels of security. First of all, if you have a computer that has data in it and it doesn't even have a password protection, then anybody can go into that computer and look at personal data. Then there are levels of access. And then if that computer is connected to the internet, it needs to be protected by various firewalls, and it needs to be protected by cybersecurity strengthening. And then, there's a difference between data kept in hardware servers and data kept in the cloud. You know, sometimes we have some very sensitive data in Lagos State that the servers that keep that data never see the internet. Because even if you connect that computer to the internet, if you connect that computer to the internet for 5 minutes, somebody can penetrate into that server and hack or steal data. So there is some data that never sees the cloud. So, but the point I'm making is that before you even start collecting data, you must have your regulatory compliance in place, and that is where our focus is right now. We're not encouraging to any great extent anybody collecting data. You can, we permit it, but we're not encouraging it right now because we haven't consolidated the governance around data yet.
That does answer. Thank you. So that would bring us to the end of this session. I'm honored to moderate this, and thank you all for coming. Thank you very much, sir. It's amazing seeing you today. Thank you.
Thank you very much.
Thank you.
Thank you very much.
Thank you so much, sir.
Okay.
Oh, okay.
Ladies and gentlemen, please would like to return back to the main hall. Please, we have
Remove
less
it.
than 3 minutes into this. So let's kindly return to the main hall.
You have to move 2 feet.
Sure.
Social media.
True.
And everyone for the idea of collaborating was out to my left.
Sorry, please hold on.
Out immediately to the left. That's where the idea
You want to join it?
Yeah. Thank you. Oh, sorry. Okay.
You have to give us 2 feet apart.
I'm sorry.
Let's make the announcement again.
Anybody else want pictures?
That's like it. That's like it. That's like it. It's like it. I think
Do we have printout of each of their ideas?
Sorry?
Do we have printout of their submissions?
No.
So I'm gonna take notes here. To know the questions to ask them, or what? We're supposed to have like at least a copy of it.
But at this point, we do not have it.
Okay. And I just get a piece of paper and
yeah.
a pen.
No, we have to take notes also so that we know questions to ask them. This is just scoring sheet, score sheet, right?
Yeah, exactly.
Fair enough. So we need like a plain sheet of paper.
Each candidate
And
has
pen.
their own scoring sheet.
Okay, we need pen and this thing.
Pens.
Yeah. And if you pen me less, so we
I
take
have a
one
spell.
there.
I have a spell.
I left my pen over there.
Mom said he was receiving a phone call.
Yes, he has a meeting. 3 o'clock meeting.
Wouldn't you suggest we start? Would you suggest we start?
Okay, you want to start now?
Because every minute we...
Yeah, call
You
him.
can always join us. Emmanuel can join us.
Call him if just
No,
so that
he's
we
on
know
an important call. You know, he was not meant to be
Okay, yeah.
judge, so he just corrupted him.
Sure. I check. Damn. So.
This thing's pulling my pants.
But you just have to just speak
louder. No, just.
Can you hear us?
Louder.
How
Don't
do you
worry.
know?
Don't worry. You just put it here, bro.
Our politician Akin pariwo. Ṣá máa pariwo ni. Ìjà la máa ń jà.
Hello, 1, 2. Test mic.
Good.
Mic test. Can you hear?
Good.
Can I brief you on the judging sheet? Please, thank you. The team has just told me that of the 10, 2 of them actually sent in their presentations, the rest of them did not.
Okay.
So, from what I'm getting from them, they don't know the presentation.
No, they can. Okay, my mic is the mic that is important.
Yeah, exactly. Everybody will hear. Okay.
No, it's fine.
It's fine, okay. So,
They should just make that one available.
okay, so make those 2 available.
See,
Okay.
all these guys. This is.
Microphone guy.
It's on. It's working.
What?
It's working, yeah?
It's working.
Okay, I think I kind of know
it's
that.
working with all of this. Okay.
Oh, it's working without it.
Yeah.
Yeah, I can hear you.
Okay, so his voice is beaming into yours. That's what's going on. The same way mine will be beaming right now. Awesome. So, these are the judging sheets. It is embarrassing, that's why I'm stalling a bit, but the print is very simple. We want to reprint, but in the interest of time, we just want to start.
That's all.
Thank you. All right, thank you. Here's the pen. Mr. Joseph, you said you have a pen. You have a pen?
Yeah, I do.
Okay, excellent. Okay, so it's simple. It's going to be 1 sheet per...
I need to turn off this mic because I can hear you. I need to turn off the mic.
Until we're ready.
Yeah, but it's still working regardless.
No, but I'll find another.
So we'll keep replacing the sheet. So if you just indicate the name of
So one of the challenges for us today is how do you fight that? How do you prevent people? So when they say today that in the US that some people want to influence election, it's real. Because you can actually use artificial intelligence using deepfake or synthetic identities to actually create images of people saying things. So the challenge is how, as the data grows in leaps and bounds, I just mentioned the fact that it's going to get to 200 zettabytes, whatever it is. Now, how do we manage that information? As we speak, a lot of banks, a lot of institutions are spending enormous amount of money to protect that data. Because if you don't, there are bad guys out there. So one of the big challenge for the IT industry is that security. So basically, we must also, one of the important things is we must provide certifications. We must, so as we teach or as we democratize education, it's important for us to actually do certifications so that's why the likes of Microsoft does that, like of Cisco does that. What it does is it allows a platform for people to check and be able to decide what is important and what is not important. So basically based on that, so for example, I think we gave out like 60 million or so for research and those type of things yesterday for young people that are out there very smart, doing all sorts of research to make sure that we protect data for startups and all sorts of things. And also we launched the Lagos, startuplagos.net, that allows everybody that has this idea, you can put it in there. What that does is that it allows investors, people that want to check entrepreneurs, to see what you are doing. Because like we said today, the world is a global village. So the truth is, people come up with ideas and they will tell us that, oh, I don't want to leave it because I don't want people to steal my idea. And I say, my friend, the truth is there are probably 40 other people thinking about the same thing. So the reality is just liberalize it, leave it out there. Let's work on it and then nobody will choose. So it is the superiority of your implementation that will do basically that. So basically, the challenge for us is how to make sure that fakes are not out there taking over our data. How do we protect the integrity of our data? And how do we continue to expand? And for state governments, the biggest challenge is we don't get measured, especially in the developing countries like Nigeria, Ghana, Sierra Leone, and the rest. IT is also expensive. So a government must then balance between the hardcore infrastructure and then data management and the rest. Good. So it's not like a private sector that has, doesn't have those type of challenges. So the reality is that, well, that market woman, that driver out there doesn't understand virus. I don't mean the virus of COVID-19. I mean our own IT virus. You understand? So when you spend money to buy antivirals, to buy this, you have to really look at it as to how do you explain it to the populace that is not tech savvy. Because we have different categories of people. And there will be some that will hold you on, there will be some. So for government in this part of the world, those are some of the challenges that we do. So basically, like I said, I don't want to look at the speech that's provided. And so I hope I've contributed to the discussion. I want to thank everybody for coming, and I hope that you've enjoyed yourself. Thank you very much.
Can I get a clap? How come?
Interference.
Oh God.
Just a warm round of applause.
Please, ladies and gentlemen, let's keep clapping. Thank you very much.
Come to the end of Arts of Technology Lagos 2.0, but I know the idea of Collaborate Lagos is still going on and will be going on for quite a number of hours, given the number of entries that we received. For all of you who have joined us here physically and virtually, we'll be bringing this yearly conference to an end. And to do that, it gives me great pleasure to welcome the convener to the stage. Please put your hands together for the Special Advisor to the Governor of Lagos State on Innovation and Technology, Mr. Tubosun Alake. I think we could do better than that. A warm round of applause for him.
Thank you very much. Thank you very much. Good evening, Lagos. Just so that I know that we've been here throughout. Smart data. Thank you very much. I hope we've learned quite a bit from the past 2 days. We've given you a number of insights on what Lagos State is doing. We've painted a picture of what the future might and possibly in many cases will look like, right? From our fiber infrastructure project, as the Deputy Governor mentioned, 3,000 kilometers of fiber optic cable, and that's just the first phase. The second phase, another 3,000, so 6,000 in total. Now imagine all our primary, secondary, tertiary institutions with high-speed internet. What do you think that will do to learning, right? So me, I'm thinking it's unfair because when I was in school, I didn't have that. So imagine the kids that are coming up today, the wealth of information that will be available to them. What things do you think they will come up with in the next 10 to 15 years? You know, I would leave that to your imagination. And so projects like that, you begin to see what is going to happen in Lagos over the next decade. And I'm telling you, the sky is no more the limit as we've pushed the boundaries of that. From the fiber infrastructure project, we go to things like the Eco 360 initiative as part of our Open Lagos project. You saw earlier in our presentation that we are digitizing millions of data sets, right? From land records that have been available since 1860. Imagine opening a file and looking back at all the data of that particular plot of land from 1860. Isn't that amazing? And everything will be available digitally. Projects like our Eco 360 project and our